can't remember things, names, titles of books.
78-year-old Dorothy Davis was having trouble with her memory. She was afraid it was more than just an age thing, that it could be something much worse.
You're getting older, you think you're losing it.
After taking a series of memory tests and a standard MRI, her doctors were worried too.
In Mrs. Davis's case, we were concerned, and her physicians were concerned that she may have an early form of Alzheimer's disease.
Previous tests had shown that Davis's brain had shrunk, a possible sign of Alzheimer's, but also a normal part of aging. Doctors needed to figure out if the amount of shrinkage was more than average. Rather than guess, they sent her for a new type of MRI at Washington Radiology Associates. Dr. Lande specializes in neuroradiology.
The advantage of this particular test is it can sort out a particular type of shrinkage, which may be reflective of dementia, as opposed to just a natural aging or what we call involutional changes in the brain.
The new test, called NeuroQuant, scans the brain, color codes each part, and measures its volume. Then doctors are able to closely look at the temporal lobe, which is associated with memory, some cognitive functions, and emotions.
And there's certain critical parts of the temporal lobe that, for some reason, the brain cells give up the ghost, basically, and they start to die. And so that part of the brain becomes smaller, or atrophied is the term that we use in clinical practice.
Once doctors have a patient's temporal lobe measurements, then they can compare it to other people in the same age group and determine if their patient has Alzheimer's.
Trying to see if, in fact, the brain has shrunk too much for a patient in that age group, in that one area that's critical for Alzheimer's disease.
After Dorothy Davis underwent a NeuroQuant scan, she finally got a definitive answer to the memory problems that had been plaguing her for months.
Fortunately, in Mrs. Davis' case, we were able to show that, in fact, the study was completely normal for her age, and her likelihood of having Alzheimer's disease was as close to zero as you're going to get.
I was in his office, and he reviewed different tests that I've had, and he said, you did well on this and blah, 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 but you don't have Alzheimer's. Yay! We were really happy.